Hi, my name is Joffres. I'm a semester 3 practical nursing student from Georgetown College. And today I'm demonstrating medication reconstitution and preparing ampicillin for IV administration via mini bag.
So the first thing I will do is to collect my supplies. So I have here 10 ml syringe, the 3 ml syringe, some alcohol swab, 2 blunt tip needle, my mini bag, 100 ml of normal saline, a sterile diluent.
So the next thing that I will do is to check and verify my medication order from my patient's MAR. So I will ensure that I have the correct medication, I have the right patient, the right dose and concentration. So my patient is Mrs. Lucia Polanski. Her date of birth is September 12, 1942. The doctor's order says that ampicillin 1000 milligrams IV every 12 hours for 7 days. I will also check for my patient's allergies and some lab work that has been done with my patient. So now I will do my first check. I will retrieve the medication from the patient drawer. So my patient is Mrs. Lucia Polanski. Date of birth is September 12, 1942. I have here the medication ampicillin. So ampicillin inhibits bacterial cell synthesis by binding proteins. It blocks the cross-linking that leads to bacterial lysis and death. So I will also ensure that this medication is not expired. So this medication is not expired. There are no cracks or it's not open. So right now this medication is not open and there's no crack on this medication. The next step that I will do is to read this medication. So I have here 1 gram of ampicillin that is equivalent to 1000 milligrams. As per protocol for IV use, I need to dilute 7.7 of sterile diluent to this ampicillin, resulting to 500 milligrams per ml. It says that dilute further in 100 ml of normal saline and to infuse it for 20 minutes. The next thing that I will do is to do my second check before preparing the medication. So I have here ampicillin, 1 gram per vial, that is equivalent to 1000 milligram per vial. I will administer this ampicillin via IV route. So my patient has peripheral IV right now, and then I will administer this medication every 12 hours for 7 days. My patient is Miss Lucia Polanski. Her date of birth is September 12, 1942. I will check this medication against my MAR. So I confirm that the details are all the same with the MAR. I will do the medication reconstitution. First, I will perform hand hygiene. And wear my gloves. Right now, I don't have gloves with me, but you need to wear gloves. First, I will open the vials. These vials, the sterile diluent and the ampicillin powder. I will open the vial and use alcohol swab to clean the top of it for 15 seconds. And wait 15 seconds while we open this other one. Then I will draw 7.7 ml of sterile diluent as per protocol to be added on this medication vial. I will use this 10 ml sterile syringe to draw up the required amount of diluent. I will draw 7.7 of air here to be added on my sterile solution. 0.7. 0.7 of air be added here to draw 7.7 mils of this solution. Now I will recup my needle to make sure that there's no air bubble, to make sure I have 7.7. So now I have 7.7 of the solution. After drawing the 7.7 mils, I will inject this to the medication vial, ensuring that it reaches the powder medication. I'm going to add it now. Recup my needle. Then I will mix it thoroughly by swirling the vial gently and ensuring that I properly mix the diluent with the powdered vial. I will avoid excessive agitation to prevent foaming or damage to the medication. The next step that I will do is to withdraw medication from this vial. I will calculate the dose that I will withdraw from this reconstituted medication by dividing the dose ordered, which is 1,000 milligrams of ampicillin, and the dose on hand I have right now is 500 milligrams per ml, and multiply it to its vehicle, which is that 1 ml. So I will withdraw 2 ml from this vial, and by using 3 ml syringe to draw up the solution. Then add this medication to this mini bag. Draw 2 ml of air, put it on the medication. So I will recup my needle and make sure that there's no bubbles. Yeah, I have 2 ml here. Then I will add this to my 100 ml of normal saline bag. So the next step that I will do is to add the medication to the mini bag. But before that, I will clean the port with alcohol swabs for 15 seconds and let it dry for 15 seconds. I will add this 2 ml of ampicillin to the 100 ml of normal saline mini bag. I will shake this one gently so that I'm ensuring that the medication is all mixed. I will also add to the mini bag a medication label with the medication name, the dose, and the concentration. I can put it on the back. And one more thing, you need to check the expiration, the contents of the mini bag before putting anything on it.
So to administer the reconstituted IV medication according to its prescribed rate, I will calculate the drip rate, and I need to multiply the volume of this mini bag, which is 100 ml of normal saline, and the drop factor of 10 drops per minute, then divided by time in minutes, which is 20 minutes. That's the infusion time that the doctor ordered us. So I am getting the drip rate of 50 drops per minute. And to calculate the flow rate of the medication, I need to divide the bag, which is this bag, 100 ml of normal saline, and divided it by time in hours. However, the infusion time that I got is 20 minutes. I need to divide it first to 60 minutes, and I'm getting 0.333. So 100 ml of normal saline divided by 0.333, I got a flow rate of 300 ml per hour.
I'll do my third check at my patient bedside with my medication. At my patient bedside, I will confirm my patient identity using their two identifier matching her wristband and the mark. So my patient is Mrs. Lucia Polanski, and her date of birth is September 12, 1942. I will also ensure that ampicillin on the mini bag matches with my mark, the doctor's order. So I have 1,000 milligrams of ampicillin here on the mini bag. So ampicillin is given to treat pneumonia, which is consistent to Mrs. Polanski's diagnosis. I will also explain to Mrs. Polanski that this is an antibiotic for her lung infection and there's some side effects as well. I will also monitor for any improvement and check for any side effects like rash and GI upset. If my patient chooses to refuse this medication, I will respect her decision, then document. Last thing that I will do is to record and document the reconstitution process in the patient medical record, including the dose, the time administered, the date, and observation or patient responses as well.